Hi, I'm Larry Downs, Chief Executive Officer at the Medical Society of New Jersey, and I'm here with Amanda Shiber, our Chief of Staff. And today we're going to discuss the disclosure requirements for out-of-network physicians under the New Jersey Out-of-Network Consumer Protection, Transparency, Cost Containment, and Accountability Act. We're going to go through a couple of slides that are going to look at what you need to disclose, when you need to disclose it, and what we recommend is the best for doing that. So, Amanda, let's start here with the first box. What does when you're knowingly seeing a patient who's out of network and that patient has decided to see you, knowing full well you're out of network, what kind of disclosures do you need to put in place to make sure that the patient actually knowingly is choosing your services?
So before scheduling a non-emergency appointment, the physician must first share their participation status with the patient. So if they're not in the health plan, they want to make sure that's really clear when the appointment scheduling is happening, saying we're not in network with this plan, and then moving forward. They also have to provide notification that the estimated amount that the physician will charge for services is available upon request.
So how does a doctor go about disclosing that? So we see a patient, they select the practice, they're aware, and they want to get a basic garden variety estimate of the charge. How should the practice disclose that information?
So if the patient, they get to the point where they've told the patient, we will disclose our fees to you. At that point, when the patient says, yes, I want to know what the fees are, so the physician should then provide CPT codes for the service and an estimated amount that the patient will be billed for those services. And then this comes with the caveat, absent any unforeseen medical circumstances that may arise, which kind of, it helps protect the physician in the case that, sometimes when you go into surgery, something else happens and something needs to be taken care of. So the patient should be made aware that that could happen and there could be additional charges as well.
So in addition to the informed consent for the procedure, there would be a disclosure of what the bills or the fees might be for that service by CPT code that the doctor reasonably expects to bill.
And it should also be in terms that the patient understands. So in addition to that CPT code, there should be an explanation of what that CPT code stands for in a way that the patient can understand it.
So upon scheduling, and we need to disclose our participation status along with the estimated amount. What about the specific estimated amount? Upon receipt of a request from a patient is what the law says.
Mm-hmm.
So what if a patient doesn't request that information?
You really just have to tell the patient that they can get the information upon request. If they don't request it, that's on the patient.
So there's not an affirmative duty to provide the information. It needs to be on request from a patient.
Yes.
It's probably good practice to provide the information or to offer the information every time, even if they're in the absence of a request. So what's the next requirement under the law in terms of advising the patient about their financial responsibility?
So in addition to telling the patient that you will provide them their fees on request, the physician also has to tell the patient that they may be liable for additional financial responsibilities above their copay, deductible, coinsurance, regular insurance coverage when they receive out-of-network care. So they have to make it really clear that the patient will be billed or may be billed above and beyond their cost sharing.
So the concept of the law and the requirements in this case is to make sure the patient's well aware of what the physician charges are going to be, so there aren't any surprises at the end of the day. And I'll note it's not part of this presentation, but there are requirements on insurers that require them to disclose to the patient what their coverage determinations are going to be. So the patient should get both sides, both the fee side and the payment side, and understand what their responsibility is going to be. So how do we recommend that doctors provide this information to patients?
So we're recommending that they tell them verbally at the time of scheduling of the appointment. So telling patients that, this is out-of-network care, additional fees may apply above your regular in-network cost sharing. We also recommend that it happen in writing in a disclosure form, and that the patient acknowledges in writing as part of the intake process as well. Just think it's really important to show that the patient acknowledges that they're agreeing to out-of-network care and agreeing to be financially responsible. I think this already happens in most out-of-network practices. I think this is already part of an intake form. It's just important to have that patient sign that they understand it.
And I think that's a good point, because what happens if we don't do these disclosures? You could find yourself in an arbitrated proceeding or in some kind of other dispute resolution process. Here, patients acknowledging they're seeking out-of-network care voluntarily and knowingly, and that's going to help the physician get paid for their services and make sure that the patient and the physician are on the same page.
I think it's also important to note that the physician's not required to know exactly what the patient's cost sharing would be, just to notify the patient that they may have to pay more than their cost sharing. The cost sharing is on the health insurer's part. They have to tell the patient what their out-of-pocket costs are for the care.
But one thing that the physicians do need to do is to advise their patients to contact those insurers for that information.
Absolutely.
And how do we expect physicians to document that advice?
Again, we're recommending that they do this verbally at the time to schedule the appointment and in writing at the time of the appointment.
Very good. So just in summary, these are probably practices that are already part of the workflow and part of the intake procedures for out-of-network practices. But if they're not, or if you suddenly become out-of-network, you need to know to implement these steps. So we want to thank you for joining us today. Don't forget to download our guidance, available at www.msnj.org/OON for more information. And please feel free to contact our Member Resource Center at 609-896-1766, extension 0, or email us at info@msnj.org with any questions.